Dr. Andre, thank you so much for having this interview with me.
Thank you for having me.
So, I have a lot of people asking me about plastic surgery in Mexico. So, why to do it in Mexico?
Okay, so we have a lot of benefits from doing it here in Mexico. A lot of plastic surgeons in Mexico and Latin America are better trained, I think, in body contour surgery, especially like liposuction, tummy tucks, BBL, stuff like that. So we do it a lot. We have a lot of practice, expertise in that. And the main advantage for patients that come from other parts of the world is cost benefit, okay? Because it's less expensive than a lot of other countries they come from, and you get the same treatment.
Even better results.
Yeah,
right?
even better results. Yeah,
That's why we have like all these soap operas, like this beautiful Mexican Latin women that have amazing body, and they're like, oh my god, they're just natural. Well, no, we're not natural. We're not natural. Not everyone, but I mean most of us. Like we do take advantage of the great plastic surgery that we have in Latin America.
Yes.
So you're in Tijuana.
Yes.
Mainly, why Tijuana? Why would people want to go to Tijuana instead of Mexico City or to Guadalajara? So.
Okay. I think the main difference between these cities is that some of the cities like Guadalajara, Mexico City, or maybe is that they are on the inside of the country. So there are less people that speak English in your everyday places, like, taxis or coffee shops or even supermarkets or something like that, okay?
Yeah, so if people do not speak Spanish, they will be, trying to translate with their phone, and they don't know where to go. So in Tijuana, a lot of people do speak English.
Yes, Tijuana is right next to the border of California. So a lot of people, if not everybody, speaks English, and they take dollars. So they wouldn't have any trouble, getting around in the city. So, and the other main benefit is that you can land in an airport that is on a big city in the United States that a lot of people know about, that is San Diego. And that is approximately like half an hour or maybe about an hour from the border. And there are some services that can pick up patients in the airport, and they can help them get to Mexico, to Tijuana, either to the surgery room or the consultation or even the hotel, and they can stay there until maybe the next day if they have an appointment or they're having a surgery done. So it's easier for them to get by and get around.
It's really convenient. So if you travel to San Diego, somebody pick you up, and then maybe they have a consultation with you, and they just drop them to your clinic, and that's it. I mean, if they have to get a lab done, you also have that service. You also can refer them to get, what it is the laboratories that you have to get done, some of them. And all those things that people will be like, oh my God, this is how scary it is. I don't speak the language. Well, you can go to Tijuana. It will be way easier, right?
Yes, it would be way easier. And the city actually has a lot of medical tourism. So a lot of these places that you're going to have big clinics and big hospitals and people that speak your language, they are tailored to the patient that comes from abroad. Okay, so you're going to have a lot of facilities or a lot of people helping you get things done easier. And they understand that you come from elsewhere, from other countries, and they're going to try to help you, and they have a lot of experience dealing with patients from other countries.
And one of the surgeries that they ask me the most, and you're really well known for that, is liposuction. So can you tell us a little bit more about liposuction? What is it? Who can get it done? Because I think that it's not for everybody, right?
Yes. Well, it can be done on anybody, but we're not going to have the same great results, and we're going to have a lot of more risk for complications, okay? So liposuction is basically a procedure where we use these cannulas, these metal cannulas, and we're going to extract fat from different parts of your body, and which parts, it depends on the results that you want, okay? So we can work the abdomen, the waist, the back, the arms, the thighs. We can work different areas. But the thing here is that it's supposed to be a procedure to help with the body contour, okay? So, and we have some limits as to how much fat we can take out without jeopardizing your health, okay? Without risking you for big complications, okay? So if, let me say, for example, if we can only take 5 liters of fat from you, it's not supposed to be a surgery that you're gonna use to lose body weight or body fat, okay?
So if somebody's overweight, they cannot go with you and be like, I want to look like the supermodel over here, because it's not tangible. Like it's not possible. So you have to give them the results. Like, see, maybe you have to lose weight first, and then, or somebody like me that I do exercise, but I do have a couple of areas that I try. So we can go with you and we can get that results. And that even apps, right?
Yeah. There are different definitions or results that we can achieve with liposuction. So, for example, we can have a patient that is a little bit overweight, but not that much. And we can take out a lot of fat and we can give a soft definition, for example. Just like maybe the center line, the midline, and the obliques a little bit.
Okay.
And we can use that fat in a lot of these patients that's a lot of what they ask for. We can use that fat to augment or increase the volume, the size, or help with the form of hips, of buttocks. Maybe in some patients even we can use that fat, for example, for the breast. Okay?
Wow.
And it all depends on the patient. That's why we insist. We always tell the patients that we need to have an appointment, because a lot of these questions, you're going to be like, oh, my friend did this, and maybe your friend was a different patient than you because of weight, because of health issues, because of the results they wanted, okay? So what we're going to do is, in the appointment or the video consultation, that's a thing we do a lot with our patients. We talk to them over a camera, the phone, or whatever, and we can work those questions they have. We can answer that for them. And we can tell them if the results they want, if we can achieve that, yes. Because there's a thing, some surgeons are going to give you, or they're going to tell you, okay, we can do that because that's what you want and you're going to pay for that. But you need a good surgeon that is going to tell you that's going to put you in risk. And this is what we can do in a safe zone that is going to ensure to the best extent that you're not going to have some complications that could affect your life.
Yeah, and that's something that you mentioned is very important, because a lot of people ask me, well, my friend just got a BBL done and with a lipo of 360 and she was only charged $5,000. Well, your friend has another body type, and it's never gonna be the same maybe price and never the same result, because we all have different bodies, right?
Yes, and that's a thing that we have to consider, because, for example, if you're a woman that has a low body fat and you want a definition, for example, of the abs, and you don't want a lot of fat, or you don't want fat injected like the BBL, there's not, the work that we have to do is different than if you have maybe like 10 pounds overweight and you want a different definition and you want lipo infiltration or fat infiltration. We're gonna have a little bit of different work, especially, for example, other patients that had some surgeries done before. They are more difficult to do because they have internal scarring or fibrosis. And it's a little bit more difficult. We have to do a little bit different work with some patients than others, okay? So that's what we include in our consultations. That's what we ask the patients about: their past medical history, illnesses they have, their body weight, their height.
And they all have to be really honest. So I cannot emphasize enough. I mean, your plastic surgeon is not gonna care if you did or didn't do. You have to be really, really honest with him or her. It is imperative, and I need to repeat this, because a lot of people is like, well, I do smoke, but I'm not gonna tell it because he or she might judge me. That cannot happen. You just have to be as honest as you can be with your plastic surgeon, so he or she knows exactly what they're dealing with.
Yes, and that's very important, because in plastic surgery, Some people think that plastic surgery is not a big surgery.
Yeah.
But if you think, in this case, liposuction, for example, we are doing surgery on your abdomen, your waist, your upper and lower back. If you think about the surface of the body that we're working on, it's really big. And that's a lot of body surface that can bleed, that can accumulate body liquids like seromas or hematomas or stuff like that. And some patients, I always tell them, are you taking any supplements? Are you taking any medications that are not prescribed for an illness? Because some of these medications, they can interfere with either anesthesia or with the blood coagulation. Okay, and that's really important for us, especially because of the safety of the surgery, but also because if you're doing a surgery, if you want an aesthetic surgery, you're gonna have a good result. Yeah. And if that's gonna alter the result, or it's gonna not give you the best result that you want because you didn't tell us something, that's something you have to consider. Yeah. Okay, exactly. As a patient,
if I didn't tell you and then I'm blaming you because I didn't have that result, but then I was taking a medication that would affect my surgery, then it will be on the patient.
Yeah. Okay. And that's, I always tell my patients, the surgery can be done with all illnesses and body weight and anything. I can do the surgery. Technically, I can do the liposuction. Yeah. But if you want this result, that's not going to happen in every patient. So that's what we have to discuss. Yeah. And sometimes, almost every time, I can tell them, okay, this is what we can do. And they're like, okay, that's perfect, because they understand the result that they're going to get. Yeah. And that's very important that you talk to your plastic surgeon, obviously. It's not going to any other type of specialist, and you tell them what you want and you be honest with them, because that's the only way that you're gonna get the best result and you're gonna be happy with your surgery.
Yeah, and if you're in Tijuana, Dr. Andre is your guy.
Yes, come to me.
Yes, and also, so I didn't know this before I met you and all these other great doctors. The difference between here in Mexico, the difference between a certified plastic surgeon and a cosmetic surgeon. So what is the main difference in both of you?
Okay, I'm going to tell you the main difference here in Mexico, because here I know how things work. So the main difference is that a plastic surgeon has to go through medical school. And here in Mexico, it's going to be at least 7 years of medical school. Okay? And then we have to take an exam, and low percentage of the people that take that exam can go into a specialty. Okay.
So even after you are a doctor, you still have to take another exam.
Yeah.
And then
get into general surgery.
General surgery, okay.
And then it depends on the programs, but you're gonna have to take or do at least from 2 to 5 years of general surgery.
Okay.
And then go into plastic surgery. That is gonna take you at least 3 to 4 years to complete.
Okay, so after 7 years, you take another 8 years.
Yeah, at least 6 to 8 or 9 years in some cases to be a plastic surgeon. Okay, and the surgical specialties, not only plastic surgery, any surgical specialty, the experience of the surgeon is gonna decide the results that he can give you. Okay, in any surgical specialty, not only plastic surgery, general surgery, ENT, gastric, etc. Okay, so the more years that you're doing surgeries, the best results you can get. Yeah. Okay, so the cosmetic surgeons here in Mexico, most of them finish medical school, and for a lot of different reasons, you can name a lot of different reasons. They go into a program that they pay for, so they don't have a filter.
So they don't. Somebody's like, okay, you don't take an exam, you just pay for it, and you can get that.
Yeah, it's like a course, okay, that you pay for, and it takes them the good courses, the good programs. It takes them from 1 to 2 years of online classes.
So online, they don't have hands-on.
Not okay. They see a lot of videos and they go to online classes. Okay. And then from time to time they go to see some surgeries.
But it's not the same as seeing and actually being and understand it.
And you have to understand that if you go every 2 to 3 months to see a plastic surgeon or a cosmetic surgeon perform a surgery, it's not gonna be the same that a surgeon did doing surgery every day and having that experience. So
it's
most
like me,
of them,
like going to my hairstylist and just checking what he's doing and be like, I can do that if I just see you. Of course not. I'm never gonna try
It's
to
hard.
get a
It's
haircut
not that
or
easy.
try to get do anything with hair.
Yeah.
If I just see, even if I watch a lot of YouTube videos, that is not gonna make me a hairstylist.
Yeah, I mean, and the hairstylist, even if you mess it up, it's gonna grow back.
Exactly. Not with plastic surgery.
In plastic surgery, you can put your life in danger because they don't have the hands-on experience that we have. They didn't have the training that we have.
Yeah.
And they, most of the times, maybe like more than 90% of the times, they're not going to be able to solve a complication as well as somebody that is trained and board certified.
Yeah.
Because they don't have that experience. Because if you say, okay, I did 100 surgeries of this type and I had 2 complications, well, that's experience.
Yeah.
And the time they take to get that experience is going to take years, and they're going to practice with actual patients.
Okay.
And what we do in our specialties is that we have teachers that are with us, and they tell us, okay, this is important, you have to watch this, and you have to be aware of this.
With you
yes, and if something happens, it's not like, okay, I learned with you. It's somebody's teaching you, and they can help you, and you learn.
While you're going.
Yeah, you learn with them, actually.
So if a complication happened, you are prepared to actually know what to do.
Yes.
Because you were trained for so many years and with so many patients and with I don't know how many surgeries you can have or you can be, I don't know, how many surgeries did you have a day or a lot, right?
Okay, right now?
Yes. I mean, no, whenever you were training.
No, it was more than 2 or 3 surgeries a day, okay? Even general surgery, plastic surgery. And it's not all aesthetic.
Yeah.
You have to do a lot of reconstruction, but those are really hard cases.
Yeah,
they
exactly.
are sometimes, or most of the times, they are more complex than aesthetic cases. So you learn about all of these. You learn a lot about the anatomy and how to work with tissues, like skin, muscle, fat.
So you learn the hard way.
Yeah. Yeah. So it's a really long journey, a hard journey. And it's important that you know that if you go to a board certified plastic surgeon, you're going to have the best chances of having a good surgery.
Yeah,
okay? So if you go with someone that learned through the internet and went to see a couple of surgeries,
to do that.
That's a lot of risk on you.
Yeah, and that's why also it comes with the money. I mean, like, yes, you can pay, I don't know, $2,000 for a breast implants, but maybe it's a cosmetic surgeon and he did not have the experience, and if something happens to you that you didn't even know that you have in your body, it's not going to be able to actually know what to do. Because
and we see all these stories, with even actresses and personalities, influencers.
And this is what I'm doing this. Thank you so much for mentioning this, because whenever I was living in the United States, people would be like, no, Mexican surgeon, oh no, don't do that. This happened to a cousin of a cousin, and they went to Mexico and they died. Well, probably they tried to search for a cheap doctor, and that's what happened. And also, it can be a lot of things. I'm not only blaming the cosmetic surgeon, but also, maybe the patient didn't tell them what was going on. But most of the time, they didn't know what to do. And then all these horrible stories go to the United States, and they all talk about only the bad experience.
Yeah,
but
they get scared.
Yeah, and that's why we're here, and we're teaching them.
Yeah. I mean, any questions you have, you can come to me, you can text me, or you can write me through Instagram, and I'll be sure to, answer them for them, because there's a lot of misinformation and they need to know what they're doing. It's not even like, oh, you have to stay with me. That's not what I want. I want them to be informed. I want them to know what they can do, what they can get with the surgeries. And if they want to stay with me, well, that's perfect. I'm going to give you the best treatment that you can get. And thank you. And
and a lot of people feel really comfortable with you, because I mean, I have friends that have gone surgery with you, and the first thing that they tell me is like, I really like, his style, and that I think is really important. I know other doctors, I'm like, oh my god, I love the way the before and after pictures, but then whenever I talk to them, or there are people that's like, oh, I don't know, I didn't feel comfortable. You really have to be comfortable with your plastic surgeon. I mean, your life is in his hands, so you have to be able to ask all these questions and for you to provide the confidence.
Yeah, you have to be comfortable with asking the difficult questions, and some people, I think they feel shy.
Yeah.
Because they think, oh, that's a dumb question. There are no dumb questions, okay? So you can ask anything you want. I know that you're not professionals, you're not experts, and I have to make sure that you understand what you're getting into.
Yeah.
And that's really important. I always tell my patients, you have to trust your doctor.
Yeah.
It doesn't care if it's the most expensive or the most, like, the cheapest, okay? You have to be able to know that if something happens, you're gonna keep talking to him or her, and he's gonna, step forward and make sure that you get the treatment that you need.
Yeah, because if something happens, like, oh, maybe, you know what, I can count on you that you will solve this for me, and not just be like, oh, he didn't do what I asked him to do, but you never talk to them. So it's really important, first to check doctor's credentials. I think it is the most important. And then is there any like a website that patients or normal people like me can go and check doctor's credentials?
Yeah, here in Mexico we have the board certified surgeons. They have this webpage that maybe we can share.
I can put the link.
Yeah, because it's in Spanish, so maybe they won't understand.
Like,
but
wow.
you can search your surgeon, and if they are board certified, they should appear there. With their certification number. Okay. So you can be sure that they are a doctor.
They cannot pay. They cannot pay to be there. So you have to be board certified to be in that website. If you're not, I mean, if they say they are, but you can't find them, they're probably not.
Here in Mexico, everybody that does medicine or is in a specialty, they have a permit. Yeah, they have a special number that gives them, like, they are enabled to do surgery. And in the big hospitals, if you don't have that, they're not even gonna let you in them. Okay?
That I didn't know. I didn't know that if you're not a board certified plastic surgeon, you can't perform and do a surgery in a hospital.
Yeah.
Like, they will ask for that.
Yeah.
So if you tell your doctor, you know what, I don't feel comfortable doing it in a clinic, I want to get in a hospital, and they're like, no. I mean, maybe you need to be checked.
Yeah, you have to check that, okay? I mean, he can have a lot of reasons, but at the end, you're gonna have to be comfortable with what you're doing, okay? There are some pros and cons about going to a hospital or doing it in a clinic. But if you want to go to a clinic, or to a hospital, they should be able to accommodate you, okay? And you should be comfortable with the surgery you're doing.
Yeah, because a lot of people in the United States are like, how many days I'm going to stay in a hospital? And they do want to be in a hospital. Yeah. I mean, they don't want to do a clinic because they might not feel comfortable, but a board certified plastic surgeon will be able to operate you and do the procedure in a hospital. So now, what are the benefits of a clinic and what are the benefits of a hospital?
Okay. Mainly the hospital is going to have a lot of equipment. So in case anything bad happens, which doesn't happen very often, okay? So you have to know that. But in case anything bad happens, you're going to have whatever you need there to diagnose and treat your patient. Okay? You're going to have the CAT scan, you're going to have the IRM, you're going to have the, intensive therapy, ICU, stuff like that. But the thing about hospitals is that since they have a lot of patients, they don't have a nurse for every patient. So sometimes the patient care gets a little bit delayed, or if you have a little bit of pain and you call the nurse, they can take a little bit of time to go there. And in a clinic where it's smaller and there are less people there, it's more personalized. The care is more personalized. Most of the times you're going to have a nurse for you, or you and 2 or 3 other patients.
So you're like in pain, like they're right away are gonna come and it's like, okay, here.
Yeah. That's like the pros and cons of choosing each one. Each one has its perks.
Yeah.
So you're just
and a hospital will be more expensive, right?
Yes.
So if you want to get your plastic surgery with Dr. Andre, he will obviously can quote you, see, this is a clinic, and again, he has all the experience that know how to handle if anything happens, which does not happen that often, but if anything happens, he will know what to do because he's already prepared for so many years. So how many years of training have you had in surgery, in plastic surgery?
Okay, so in surgery as a whole, because experience is important, I've had more than 10 years.
More than 10 years.
Actually, I'm a general surgeon. Okay, a board certified general surgeon. Okay, I did 5 years of general surgery. And then I went to plastic surgery, and I have more than 5 years of experience. Okay. I am fortunate enough because right now I do at least 4 to 5 procedures a week, most of the weeks.
4 to 5 procedures.
Okay. Obviously, there are doctors that do more. There are doctors that do less. Sometimes I have more. Sometimes I have less.
In the States, not a lot of people have plastic surgery, so that's why also Latin American doctors, Mexican doctors, especially have all this knowledge to practice.
Yes. Right? There's another thing that is important because I have heard a lot of patients mention it. I don't know. I mean, the experience varies with each doctor, but I've heard that in the U.S. to get in touch with a specialist and to be able to call them if anything happens, it's a really bad experience. Okay, so you're not able in most of the times to be close to your surgeon because of that. At least with me here in Mexico, I try to be in touch with them. I try to write them and, how are you doing?
To check out on them.
Yes, and you can talk to me as if you talk to a friend. And that's a good thing because you have more confidence in asking anything you want. And I always tell them, if you want to get in touch with me, send me a message. If you think it's urgent, call me. And I give them my phone.
Yeah, wow.
Okay, yeah,
that's personal
that's a
treatment
plus.
right there.
And, some patients, they feel better that way because when I tell them that, they're like, oh no, I'm not going to bother you. Don't worry. It's like they're not worthy of that. And I think that's bad. I mean, you have to be close to your patients in the good and the bad times.
Yeah. And there's a lot of, even in Mexico, for sure in the United States, you first talk to a patient coordinator, and then almost whenever you're going to get to the surgery, you might talk to the doctor. And then after that, you never talk to the doctor. You never see the doctor again. You forget about it. Because he is really busy or she's really busy. So yeah, normal people like me, think that they're not worth of doctor's time. But now with you, you do truly care about your patients and their results. And that's why you're so popular with liposuction. And so good at your work. And then people trust you. So that's why they keep coming and recommending all these people with you.
Yes.
In summary, if patients want to get surgery, I would recommend, if you are from the United States, if you're not from the United States, you can go to San Diego, travel to Tijuana, and then talk to you. And I'm going to add all your information.
Thank you.
The link of your website. They can even contact me, and I can do an appointment for you. So that way, if you're doing surgery, I can do the one to talk to your assistant, and they can do the appointment, or they can just directly talk to your assistant.
Yes.
But this is just to help to understand a little bit of what plastic surgery is and why to come to Mexico, why to come to Tijuana, why to really research your doctor, and to be honest with them, to ask them as many questions as you want. What you said, there's no stupid question. Don't feel like, just because you're not a doctor, just because you don't know these things, they might make fun of you. No, they don't, because you heard all these questions all the time. So
yes, that's really important. The patient has to be honest about everything. They have to tell you or try to come to terms with the surgeon with the results they want. So that's the best way that we can achieve a good relationship between doctor and patient, and be honest and real about the results you can get.
Okay.
So be honest, talk to your surgeon, do some research on them, actually, know that you
can even ask them for, before and after photos. That's one of the main things that people want to see, obviously, because if you want to get even, your makeup or whatever, you will see photos. Why not to do it with your plastic surgeon? Obviously, since you can see, okay, I like this result, and they can also tell you, oh, well, this patient did not want to get a BBL that big. So, but if you want, we can do that with you, or
Yeah, so that's every patient has different needs and has different goals. Okay, so if they want a big BBL, that can be done. If they want something small or more natural, or that goes more with the figure they want, that can be done too. Okay, so we can tailor the results to whatever you think you want, and we can also point you in the right direction to get the best result that we can give you based on your past medical history, on your body measurements, your height and weight. We can talk about that in detail. And you know, at the end of the day, if you're happy with what you heard, if you understood everything I told you, I think you're gonna have the surgery with me, because you're gonna understand that that's the best that I can give you, and that's the best that you can get in a safe way. And if you know, this is not a contract, so if they want a video consultation and they're like, okay, I didn't like this, or I want to do some other research or consults,
they can always go see other doctors. And then, I mean, you are also, you know, looking for what is convenient for you. So, and again, don't go because of the price, or don't go because, you know, he or she have a beautiful face or whatever. You know, just like really search your doctor, really, you know, be trustworthy with your doctor. That I think is the main reason.
Yes.
And thank you so much for this interview. Thank you so much for
having
answering
me
all
again.
these questions. And I think a lot of you will absolutely love this interview, because they keep asking me all these questions that I just asked him, and he was so honest and so clear, and you guys are really gonna enjoy, you know, having this video. But thank you so much, doctor.
Thank you again, Andrea. I'll see you soon.
Yes.